are you there? I am Pharma and we'll be talking about Clomiphene.
Are you referring to me?
Yes, I'm talking about you.
Well then, let me introduce myself first. Hi, my generic name is Clomiphene citrate, but you can also call me with my brand name as Clomid or Seraphim.
But if you have a cyclic ability, you might prefer her chemical name, 2,4,2-chloro-1,2-diphenylethinyl-phenoxy NN-diethylethanamide.
Why did you have to include that? It's too lengthy and embarrassing.
Oh, come on. You must be open to them if you want them to know you.
Yeah, you're right.
Well then, let's continue.
Okay, so I have two drug classification. I can be therapeutic and pharmacologic at the same time.
Yes, she has. She is a stimulant to ovulation and a chlorothyroxine derivatives of the latter. Clomiphene belongs to category X in pregnancy, wherein studies in animals and humans demonstrate fetal abnormalities or adverse effects. The risk of use in pregnant women clearly outweighs any possible benefit.
Go ahead, tell them. I assume you know everything there is to know about me.
Oh please, don't hate me. You're like a sister to me, you know?
Fine. So where were we? Oh, my mechanism of action. So I have both estrogenic and anti-estrogenic property, but my precise mechanism of action has not yet been determined.
Clomiphene appears to stimulate the release of gonadotropin, follicle-stimulating hormone, luteinizing hormone, which leads to the development and maturation of ovarian follicle, ovulation, and subsequent development and function of corpus luteum, which leads to pregnancy.
Gonadotropin release may result from direct stimulation of hypothalamic pituitary axis or from the decreased inhibitory influence of the estrogen to the hypothalamic pituitary axis by competing with the estrogen of the uterus, the pituitary, and the hypothalamus.
Clomiphene has no progestational, androgenic, or anandrogenic effects and does not appear to interfere with pituitary adrenal or pituitary thyroid function.
Wow, you really do know me. Now, moving on my pharmacokinetics. I am readily absorbed in the GI tract. Regarding my distribution, I may undergo enterohepatic circulation or may be absorbed on the body fat.
Clomiphene is metabolized by the liver. She has a half-life about 5 days and is excreted in feces via biliary elimination. Her route is through oral administration, while the onset, peak, and duration is still unknown. Before we continue, let's refresh our minds of what I and Clomiphene have talked about so far. First, we've tackled about drug name, which includes generic name, brand name, and chemical name. Second, we've talked about drug classification, which can be therapeutic and pharmacologic. Third is about pregnancy category, wherein Clomiphene belongs to category X. Then, the mechanism of action, followed by the pharmacokinetics.
By the way, not to brag, but I'm created to be kinda useful. You see, I'm indicated for female infertility due to anovulation to induce ovulation. So basically, I'm one of the reasons for all of the babies living today. But of course, I am not perfect or suitable for everyone. I am contraindicated for hypersensitivity, pregnancy, kidney disease, abnormal uterine bleeding, ovarian cyst, and others such as adrenal dysfunction or in the presence of organic intracranial lesions such as pituitary tumor.
Hey, let me spill about side effects.
Oh sure, please continue.
Clomiphene's side and adverse effects are identified in certain body parts or systems. In CNS or central nervous system, it includes headaches, depression, convulsion, and insomnia. And EENT or involving our eyes, ears, nose, and throat, it involves blurred vision, diplopia or double vision, scotoma, and photophobia. In GI or involving our gastrointestinal tract, nausea, vomiting, bloating, and distension, ovarian hyperstimulation syndrome, endometriosis, abnormal uterine bleeding, ovarian enlargement, and cyst formation that it regresses spontaneously when drug is stopped are all present in GU or genital urinary system. In the respiratory system, coughing and dyspnea are observed.
Other adverse effects include hot flashes, reversible breast discomfort, rashes, hair loss, and oops, weight gain.
Oh, I didn't hear about that. By the way, there was this nurse who is notably professional. Before Clomiphene administration, she conducted a health history assessment to the client, noting any sensitivity to Clomiphene, kidney disease, uterine fibroids, and abnormal vaginal bleeding, which is crucial to Clomiphene function. Next, she did a physical examination, assessing the client's skin color, ophthalmologic examination, pelvic examination, liver evaluation, and checking the urinary estrogen and estriol levels. She provides her a calendar of treatment days and explanation about sign of estrogen and progesterone activity. Cautions were also indicated as 24-hour uterine collections will be needed periodically, and the timing of intercourse is important to achieve pregnancy. She also alerts her of risks and hazards of multiple births, and explained failure to respond after 3 courses of therapy probably means that drug will not help, and treatment is to be discontinued.
Really? That's job well done.
Not just that, during treatment, she asked to report any experience of bloating, stomach pain, yellow skin or eyes, abnormal bleeding or bruising, fever, chills, and any visual changes. She monitors her almost every minute for abnormal bleeding. If it occurs, full diagnostic measures is crucial. She instructed her to report it immediately. Lastly, she monitors her for visual disturbances and explained that their occurrence indicates the need for a complete ophthalmologic evaluation. She clarifies that drug will be stopped until symptoms subside.
I remember that. She doesn't seem to have trust in me. I remember her saying, if Clomiphene is continued to be administered for over a year, the patient should have ophthalmologic examination in regular intervals.
That's kind of weird.
Well, I'm just gonna prove to them that I am more than this.
That's the spirit.
Wait for me, people. I'll be back with a better version of me.
Yeah, that's it. And let's talk about it soon. Bye!